No, there we go. Okay. So thank you very much for this opportunity to share with you what we've been doing at the national level to try and battle the residential wood stove smoke problem. And I'm going to apologize in advance. Most of my slides are very texty, not like the beautiful slides that Morgan had to show you. So I hope it won't uh, overwhelm you in just the lack of pretty pictures in here. So in terms of background, as many of you know, residential wood stoves produce smoke that's a problem in a number of areas in Canada. One of their main emissions is PM 2.5, and some sources estimate that in the wintertime, wood stoves are responsible for 65% of wintertime PM 2.5. And PM 2.5 itself kills 9,500 people in Canada a year. It's associated with aggravating various lung conditions, bringing on heart attacks, and even lowering resistance to infection in children who live in homes where wood stoves are used. Wood stove heating is responsible for 91% of all human-caused polyaromatic hydrocarbon emissions in the country. Wood stoves put out 12% of Canada's VOCs, which is far more than all other heating sources combined. Dioxins and furans, 10% of Canada's annual emissions. Carbon monoxide, 20%. Compared with natural gas, wood stove puts out 2 times more CO2, 60 times more methane, and 400 times more nitrogen dioxide. So it is no longer considered to be a so-called carbon neutral heating source, especially since it releases 31% of Canada's black carbon emissions. That's the black soot that comes when you burn things. And black carbon, although not a greenhouse gas, is a climate forcing emission. And it's shocking that no action has been taken in Canada on this particular source of emissions. There has been some local actions. Some BC municipalities have some bylaws, and BC has actual wording in provincial legislation about it. And Montreal and the province of Quebec also have some regulatory actions being taken, but nothing else, mostly because I think government people don't like to reach their policy arm inside people's homes and tell them what to do. But we need to get over this mindset. About a year and a half ago, we had a conference in Fredericton, bringing in a small group of wood stove experts. Some of you might notice yourself here. Um, and that conference led to a number of suggestions. I've put in red here the recommendations of that committee. The first one of which is to develop a government and stakeholder committee to further take action on the early recommendations of that workshop. In other words, to suggest a pathway for creating regulatory frameworks, increasing awareness, undertaking research and monitoring, finding good solutions, inexpensive and secure heating solutions for remote and rural communities and during power outages. And also, we want to engage those that are making climate change mitigation policies so that biomass does not, some recommendations to use biomass for climate change reasons does not make the air quality worse. So as a result of this committee, the federal government has given us a further grant that's just, the work for which is just ending now, to create this government and stakeholder committee. And so we've been working on this committee since last November. It has 22 members from municipal and provincial governments, NGOs, a medical officer of health, and a representative of the Hearth Patio and Barbecue Association. And we've been working to build up information on those different recommendations and try to design recommendations for actions to reduce wood stove smoke in Canada. So in each of those priority areas that were mentioned on the slide before, we tried to define the best actions for success, provide information that supports those recommendations, and identify the pathway to success. In other words, who are the key decision makers that we need to reach? How do we reach them? And how do we get buy-in from those decision makers? And certainly there are still gaps remaining in the knowledge that we need to achieve some of those steps. If we have a quick look at the regulatory framework piece, one key recommendation is to have the Woodstove issue allocated to a Canadian government department for management oversight and action, or it might even be two government departments. I'm thinking Health Canada would be a good lead on this, but perhaps Environment and Climate Change Canada might need to be the lead for the regulatory piece. We are still unsure of where the jurisdictional authority is for all the different actions that need to be taken for this topic. And we're suggesting that the federal government do a jurisdictional scan to see what the federal government could do, what the provinces could do, and what would fall to municipalities. I think I mentioned all that already, that BC has a provincial-wide wording that references the sale of certified stoves and the need to burn clean, dry fuel. That's probably also what Quebec's looks like. And that would be a starting point, let's say, if the other provinces and territories could at least have that wording in their legislation. It could be that some of you know that maybe Nova Scotia PI or Newfoundland has that wording in provincial legislation. I'd really like to hear from you if that's the case. Typically, federal governments produce guidelines and standards and leave the provinces to do the regulatory control of things. And the committee really did felt that this issue is best regulated at the provincial and territorial level, because if you try and put it on the shoulders of the municipalities, that's a lot of advocacy, municipality by municipality, to try and get bylaws in place. It's a lot more work than going just to the provincial territorial level. The committee worked on a framework to provide the outline of what all the regulatory components that would need to be considered for that. And we would like to ask the Canadian Council of Ministers of the Environment to add wood stove smoke to the work of the Air Quality Management Committee. It has had some resonance at that committee, but really it needs its own subcommittee working on this issue, because it is a complex issue and it really needs the buy-in of all the ministers of environment, which form the CCME. Under the topic of increasing awareness, we used to call this increasing public awareness, but the committee said it's not just the public. We need to educate and inform. There's many different categories of how you would do this. And once again, we think that the responsibility for this should be allocated probably to Health Canada to create a strategy for this, to engage stakeholders and roll out education across the country. To people like wood-burning Canadians, the general public, policymakers need to understand the background for the need for these actions. Health professionals, various NGOs, and retailers who sell the stoves so that they can provide health information and better burning practice information. And those of you that have done education or a change out campaign know that public education is best linked to other actions, like a wood stove change out campaign, to retrofit programs that might be promoting heat pumps, to real estate transactions. If you're selling a house that has a wood stove in it, that's a great opportunity for education, and to put some information at the point of sales. And the goal of increasing awareness is to change the social norm. Canadians love their wood stoves. Wood stoves are the only source of heat for some Canadians. And we have to be careful of that reality when we send out our messaging. but we need to move people away from the idea that as a Canadian, they are wood burners, because there are other options in many places and in many instances. Perhaps not all. I'm thinking of northern or remote communities, but we can do a lot better in more urban areas, especially. We need to send stronger messages to not burn, not just better burning messages. We need to focus on the health impacts, because that's what grabs people's attention. People do care about their family health, and they need to know what the health outcomes are of exposure to wood smoke. And policymakers certainly would be motivated if they see the percent contribution to particulate matters, particulate matter, polyaromatic hydrocarbons, black carbon, and other climate forcing chemicals. And we need to have a positive tone to this. So once you begin to put all of these things in the mix of the messaging, it starts to get a little complicated. But we do need to provide wording to convince people to adopt new policies, to get them to get away from the mindset that it's a very affordable way to heat their homes. Because if you internalize the currently externalized health costs, then it is not a cheaper way to heat your home. And we also, of course, need to evaluate when we run public awareness campaigns to understand what their impact has been. Under the category of research and monitoring, the committee, the experts on the committee suggested that we have plenty of evidence for the health effects of wood stove smoke. We don't need more research in this area to be able to make the point that we need to take action. What we do need is to take action on things like to review how wood stove smoke is managed and regulated in jurisdictions that look like Canada, to see what we can learn from them, and also to analyze and monitor the impact, as I said, of education programs and incentive and disincentive programs. It's a hard sell sometimes to municipalities and provinces to take up regulations and bylaws. They often want local information on health impacts. And those of you that are population epidemiologists, you understand that in small communities, such are common in Atlantic Canada, you can't do a population epidemiological study with such small communities, because you don't get the right statistics. So we would need to convince policymakers that the health effects evidence alone should be enough to take action on this issue. The issue of trying to find heating solutions for remote, rural locations for low-income Canadians and during power outages was very much harder for us to tackle, because there's such a diversity of situations across Canada. It's hard to recommend any one answer here. One of our recommendations, I think, to Health Canada will actually be to create a strategy for better home heating or building heating solutions in these situations. But some of the things that we have found is that, for example, we know that all actions taken for climate change reasons to reduce greenhouse gases would also reduce heat loss, for example, during power outages. So things like increased insulation, installation of solar panels, or some small community connections to combined heat and power might be some solutions. Some northern communities have found that installing power, the air-to-air heat pumps in homes has greatly reduced the use of wood stove smoke. So programs that give incentives and rebates and help support the cost of those sorts of like insulation and the installation of heat pumps would be helpful to everyone in Canada, particularly low-income Canadians. And there are several sources that recommend heat pumps and to lower costs and emissions. That's I don't know if that link will work for you, but I'm hoping that the organizers can share our PowerPoint presentations with you guys if you want to further explore these links that are in here. And once again, coming back to low income Canadians, we need to, especially for policymakers, explain to them that wood stoves are not always the least expensive option. That if you leave out the health costs, it's hard to quantify that because the cost of wood and the quality of wood varies greatly across the country. But we know if we internalize the healthcare costs, like this example in Metro Vancouver, that put some numbers on it, then it does show that heating with wood becomes very expensive for the health costs that provinces have to bear. And once again, that study recommended the installation of heat pumps. And finally, looking at climate change, or maybe I think there's one other aspect after this one, but talking about climate change mitigation actions, as you know, sometimes the use of biomass is listed in sets of mitigation actions. There are good ways you can use biomass, and there are bad ways you can use biomass, because depending on what you're recommending, you can increase air pollution. There are, for example, examples from London, England, where this was a recommendation and their air quality got significantly worse because people turned to wood stoves, and the healthcare costs completely negated the, the climate change impact costs that they might have been trying to avert. But as I mentioned at the start, it's not a climate neutral solution. You burn wood very quickly. You can burn a whole tree very quickly to heat your home, and it takes 30 to 50 years to grow that tree. They do absorb carbon. They do absorb carbon dioxide, but you are releasing it very quickly into the air. So that is not a correct balance sheet if you are saying that it is climate neutral. It does release 2 times more CO2, 60 times more methane, 400 times more NO2 for each unit of energy produced compared with natural gas. And we know that electricity, depending on the source of electricity, if you have a green power grid, it's way better for greenhouse gases than burning wood. And I mentioned before, black carbon is a climate forcing agent, and wood stoves produce 31% of all black carbon emissions in Canada. So we need to connect with the people who are policymakers making climate change policy decisions to make sure that they use this lens when they're making their decisions. And so that's it. And of course, this picture is just the first picture was showing wood stove smoke coming from a house. This one shows heat pumps and insulation as a better choice in many instances, not all, not necessarily in remote or northern communities. But as you can see, just having walked through a number of these issues, it's a complex issue, particularly aggravated because Canadians like their wood stoves. They think it's a natural source of heat, and many Canadians are still unaware of the health impacts that are arising to their families and their neighbors and their communities as a result of them thinking that they're using the Canadian way to heat their house. Happy to take any questions that you might have.